For society, the biggest benefit is that we spend our money more wisely. Hello, I'm Lieven Annemans. I'm a professor of health economics at UGent University in Belgium and also associate partner at Vintura. In this video message, I would like to share with you some do's and don'ts regarding health outcomes-based agreements and why they are useful. Health outcomes-based agreements mean that sooner or later the payment for the medicine will be in function of the health outcomes in the real world. One of the key challenges today with the value assessment of medicines is uncertainty, because indeed at the time that the new medicine approaches the healthcare market, there is still a lot of uncertainty, for instance, about the sustainability of the effect, the possibility of relapses, what will be the population in the real life that will get the medicine. And in order to deal with those uncertainties, I believe that the solution is health outcomes-based agreements. And there are two types. The first one is what we call coverage upon evidence development. It means that the medicine is covered by the health insurance, but not for always. There will be some point of verification in the future, and at that point of verification, the performance of the medicine in the real world will be assessed. And in function of that, the further coverage will then be decided. The second type is called performance-linked reimbursement. Also there will be a point of verification in the future, and if the medicine is not performing as well as promised, then the company will have to pay money back to the health insurer or to the National Health Service. Today, if you put yourself in the place of a patient, there is a lot of uncertainty about the value of new medicines, and as a result there is a lot of discussion and delay of access. With this new concept, access can be accelerated. For society, the biggest benefit is that we spend our money more wisely, because if the medicine is not performing as promised, then the payment for that medicine will be lower, and as a result we will have more efficient spending of our healthcare money. I'm convinced that the pharma industry should engage in these kind of health outcomes-based agreements. Especially those who have truly innovative medicines will benefit from it, because this concept is related to value-based healthcare. Better value will also be better rewarded. Today we see financial agreements where there is a discount, the same for everybody and regardless the additional value. The next step now is clear. We have to engage in it. We have to do pilots. As they say, the proof of the pudding is in the eating. Well, we have to find a coalition of the willing, as they say, those parties that are willing to engage in that kind of contract. Now, it also means that you have to follow some do's and don'ts. And we have published 10 guidelines about health outcomes-based agreements. For instance, you have to agree on the point of verification. You have to agree at day zero what will be the implications if the medicine does not make the promises at the time of verification. And there is a long list of that kind of advices. And I would recommend to engage in a pilot, to follow the guidelines, and then I'm convinced it will be successful.